Welcome back. And we have joined us Luzmam Vigil, Community Engagement Manager, here to talk about the Golden Years program offered at North County Health Services. Luzmam, thank you for joining us.
Thank you for having me.
So what is your, I gave the title, but what is your role at North County Health Services?
So basically my role as a community engagement manager is to get to know my community, get to know the needs that they have, and hopefully be able to help them with that by bringing resources and services to them.
So one of those resources is this Golden Years program. What is that? Can you tell us a little bit about it?
Yes, of course. So Golden Years is a support group for individuals that are suffering a behavioral health issue. It could be for their family members as well, so that they can know how to support that individual. What we do is we provide support for them, not necessarily counseling, but it's just a support system for them where they can come once a week, meet with other individuals that are suffering the same behavioral health issue that they're suffering that come from the same culture, that speak the same language as them. And then we also have a senior community liaison that works with them directly on an individual basis, where she provides more of a one-on-one support for them. So if they need support with housing, we'll give them that information. If they need food, we'll connect them with food resources.
That's outstanding. So when I hear Golden Years, I think of the Golden Girls. Is it specifically for older people, or is it?
Yeah, well, not anymore. It did start, this program has been existing for over 10 years. Really? And originally it started for the senior population because they saw that there was a need for them. However, as the years have gone by, we know that the behavioral health issues not only affects the senior population, but all ages. Mm-hmm. And we still kept the name because we love that name, Golden Years, and everybody that has been with our program kind of identifies with the Golden Years. But we have expanded it to allow other adults as well. So not necessarily 65 or 60 years of age and up, but anybody that needs that support, they can come.
So I'm very curious about the programs and the activities you offer. Is treatment the right word for it?
No, we don't call it treatment because we're not licensed. We have our behavioral health consultants, our psychiatrists internally at our clinic that have all the requirements for licensing, and they're the ones that provide the therapy and the treatment. This is more of, it could either be the first step for an individual. Sometimes they are suffering from something like depression, anxiety, and they're still not ready to see a psychologist or seek treatment, and this could be the very first step. And once we identify that this individual needs additional support, then what we're able to provide for them, we could connect them with our providers. And this could also be as a complement to somebody that's already seeking treatment. Mm-hmm. Or it could be the final step for somebody that they're already finished with their treatment, but they still need that little push. And this gives them the opportunity, like I said, to connect with individuals that are going through the same thing, so that they know that they're not alone, and that it's okay that you're not having a good day, but you're going to survive. You're going to be able to get out of that, whatever it is that's affecting you.
Some of your colleagues who were on the show had spoke to, advice for someone, or if they know someone that might have a behavioral health concerns. And so it sounds like going to this Golden Years program without necessarily a doctor recommendation, you can just come in off the street. Really?
Yes, yes. It is open to the community at large. We are a North County Health Services program, but you don't have to be one of our patients to come, because we know very well that to take that first initial step to seek treatment, it's very hard. So we're not going to turn you away just because you're not one of our patients.
That's fantastic. So can you share a little, maybe 1-2 activities that what's a typical activity?
Well, every week it's very different, but we do we try to bring presenters from other agencies to talk to them. Over the years, we've invited the fire department to talk to them about senior safety in case of a disaster. We've invited insurance providers to come and talk to them about how to qualify for Medi-Cal and Medicare. We've also had the Elizabeth Hospice come in and talk to them about their options for end of life. So we want to have them to be
options for, I didn't catch that.
end of life.
End of life, so passing on.
Yes.
This,
Yes.
okay, and who do you have? I've never heard of this program. You have someone come in to talk about.
Yes, and that's an external agency from Elizabeth Hospice. So we try to bring as many resources to our members, and that that happens on a monthly basis. Besides bringing external resources and information for them, we have fun activities like our annual fashion show, which is an opportunity for them to dress up, feel glamorous, and boost their self-esteem.
That is awesome. A fashion show, and I guess relating to behavioral health, I mean, I'm sure that putting an outfit on, walking on the stage, does that do something?
Yes, it does. We have individuals that's the only time of the year where they get to dress up and they get to wear makeup, and unfortunately we don't have the funds to pay for their outfits, but we do bring in volunteers to help with the makeup and in the hair. So it's just so wonderful, and they're able to walk and show their family members that they still had it.
What support can this program offer? Besides that, is there any other services that the Golden Years provides?
Well, like I said, a lot of resources and services that are available for them. So at North County Health Services, we want to be more than just a medical provider. We want to be able to connect them with resources out in the community, and again, that individual support and connecting them with their peers.
So you talk about support. So what are some of the issues that a person coming to the Golden Years face?
A lot that we see is, besides anxiety and depression, is the feeling of loneliness. They come from a different country at times, they speak a different language, and to integrate into mainstream America is kind of hard for them at times, and this gives them an opportunity to know other individuals that have the same issues that they do, that they came as an older adult, not necessarily when they were teenagers, so they didn't get to experience living here as a teenager. So they're coming from as an older person. And, sometimes it's good to talk to somebody about your roots and to keep some of your traditions, and that gives them an opportunity. We celebrate La Posada, we celebrate a variety of holidays, not just the typical Thanksgiving and Christmas. We do a lot of things.
So there's a particular demographic that seems to be utilizing the services a little bit, and who are they?
Right now, we are working primarily with the Latino population.
And if someone would like more information about your program, how do they get that? Who do they contact?
They can go on our website. We're listed under community programs. You'll see a link to the Golden Years program, or they can call me directly or email me.
Okay, and just give me, they'll probably put it, but your email address is?
Yes, my email address is Luzmam. It's L-U-Z as in zebra, M as in Mary, A as in apple, and M as in Mary, .vigil@nchs-health.org.